Most people only notice kidney disease when serious damage has already happened. That is what makes kidney problems so dangerous. Your kidneys can slowly fail without causing clear pain or strong symptoms in the beginning. By the time many people realize something is wrong, their kidneys have already lost a large part of their function. Most people think kidneys only work as filters that clean the blood and make urine. That is true, but it is only part of the story. Kidneys also control the balance of salt, potassium, and other minerals in the body. They help keep the blood at the right acid level. They play a role in keeping bones strong. They even help control blood pressure and support the production of red blood cells. Because kidneys do so many important jobs quietly in the background, small problems can grow for years without being noticed. Chronic kidney disease usually progresses slowly. One kidney can compensate for the other, and even damaged kidneys can keep working well enough to hide trouble. This is why many people feel normal while the disease continues to advance. There is often no sharp pain, no sudden warning, and no dramatic event that forces someone to see a doctor early. A very dangerous belief is, no pain means no problem. This idea leads many people to ignore early warning signs or skip routine testing. Kidney disease does not behave like a broken bone or an infection. It does not always hurt, swell, or cause fever at first. Silence does not mean safety. In fact, silence is exactly how kidney disease causes the most harm. The goal is not to create panic, but to create awareness. If kidney disease is detected early, the root cause can often be treated and further damage can be slowed or prevented. That is why learning the early signs matters. But the first signal of kidney trouble often starts in a place most people overlook: the bathroom. If you have never really paid attention to your urine, you are not alone. Most people flush and move on without looking. But urine can give one of the earliest clues that something is wrong with the kidneys. One of the most important changes to notice is foam. Foamy urine does not mean a few small bubbles that disappear within seconds. Those bubbles are usually caused by speed or pressure and are harmless. What matters is a thick layer of foam that looks white, dense, and stays on the surface for a long time. A simple way to imagine it is the foam you see on top of a beer. That kind of foam is not normal. This happens when a protein called albumin leaks from the blood into the urine. Healthy kidneys have tiny filters that allow waste and extra fluid to pass through, but keep important proteins inside the blood. When these filters become damaged, they develop small gaps. Albumin is small enough to escape through those gaps and end up in the urine. Albumin has a soap-like structure. When it mixes with urine and hits water, it traps air and creates foam. That is why the foam looks thick and persistent instead of light and quick to disappear. The more albumin that leaks, the more noticeable the foam becomes. Many people ignore this sign because it does not cause pain and does not feel urgent. Some people even assume it is caused by dehydration or something they ate. While foam can have harmless causes, persistent and heavy foam is different and should not be ignored. This change in urine is often one of the first visible signs that the kidney filters are under stress. But the problem does not stop at the urine. Losing albumin starts a chain reaction that affects the entire body. But this urine change does not only affect the kidneys. The protein you lose in your urine does not just disappear quietly. It starts a chain reaction that can make your body swell with fluid. Albumin has an important job in the blood. It helps keep fluid inside your blood vessels. When albumin levels drop, fluid escapes from the bloodstream and leaks into nearby tissues. This is why swelling begins. A simple way to check this is with a quick test. Press your thumb firmly into the lower part of your shin for about 5 seconds, then release it. If a dent stays behind instead of bouncing back right away, this is called pitting edema. It means fluid has collected in the tissue. Many people are surprised when they see this for the first time. Swelling often follows gravity. That is why it usually appears in the feet and lower legs first. If the problem continues, swelling can also show up around the ankles and even around the eyes, especially in the morning. The skin may feel tight, heavy, or uncomfortable, even though it may not be painful. Here is where the problem gets worse. Even though the body looks swollen, there is actually less fluid circulating inside the blood vessels. The kidneys sense this as dehydration. They think the body is low on fluid, so they respond by holding on to salt and water. Instead of fixing the problem, this makes the swelling worse. More fluid is pulled into the tissues, and the cycle continues. This confusion creates ongoing stress for the kidneys. They are trying to protect the body, but their response adds to the damage. In more serious cases, extra fluid can even collect in the lungs, making breathing harder. That is why swelling should never be ignored, especially if it does not improve overnight. But the most damage often happens quietly during the night, while you are asleep. Getting up multiple times at night to use the bathroom is often ignored or blamed on age, stress, or drinking water late. But frequent nighttime urination, called nocturia, is not always a healthy sign. In many cases, it can be an early warning that the kidneys are not working the way they should. Normally, your kidneys change how they work at night. When you sleep, your body releases a hormone called ADH, also known as antidiuretic hormone. This hormone tells the kidneys to conserve water and produce smaller amounts of more concentrated urine. That is why most people can sleep through the night without needing to urinate. When the kidneys become damaged, one of the first functions they lose is the ability to concentrate urine properly. Even though ADH is present, the kidneys fail to respond to it. As a result, urine stays diluted, and the body keeps producing larger volumes of urine throughout the night. This forces you to wake up again and again to go to the bathroom. Many people assume that peeing more means their kidneys are doing a good job. In reality, quality matters more than quantity. Producing a lot of dilute urine is often a sign that the kidneys are struggling, not that they are healthy. This problem often appears early in chronic kidney disease, long before pain or other obvious symptoms show up. Because nocturia develops slowly, people adjust to it without realizing something is wrong. They plan their sleep around bathroom trips instead of asking why it is happening. Over time, poor sleep also adds stress to the body and worsens overall health. Now, take a look at your nails because they do not lie about what is happening inside your body. Nails are not just about appearance. They can reflect what is happening inside the body, including the health of the kidneys. Most people never look closely at their nails, but small color changes can sometimes reveal serious problems. In healthy nails, it is normal to see two areas of color. Near the base of the nail, there is often a pale, half-moon shape called the lunula. This area represents new nail growth and usually looks white or light pink. The rest of the nail bed has a natural pink tone because of blood flow underneath. This pattern is common and not a cause for concern. In some people with chronic kidney disease, the nails look different. Instead of a small lunula, the nail appears split into two clear halves. The lower half near the base looks pale or white, while the upper half turns a darker red or brown color. These are known as half-and-half nails. This change is not caused by nail polish, injury, or poor hygiene. Not everyone with kidney disease develops this nail pattern, but when it appears, there is a strong association with long-standing kidney problems. Doctors are not completely sure why this happens. It may be related to changes in blood flow, waste buildup, or hormone imbalance caused by failing kidneys. This sign usually appears later in the disease. The reason is simple. Nails grow slowly, and visible changes take time to develop. By the time nails clearly reflect kidney damage, the condition has often been present for a while. That is why relying only on nail changes can be risky. But the real danger is not on the nails. It is hidden deeper, just under the skin. A mineral you eat every day can slowly turn into stone inside your body. That mineral is phosphate. Phosphate is found in many common foods, especially processed foods, meats, sodas, and packaged products. Healthy kidneys remove extra phosphate without trouble. When the kidneys are damaged, phosphate starts to build up in the blood. High phosphate levels create a serious problem because phosphate binds tightly to calcium. When both levels are high or poorly controlled, they combine to form calcium phosphate crystals. These crystals are hard, sharp, and not meant to exist in soft tissues. Once they form, They can deposit in different parts of the body and cause damage. When these crystals settle in the skin, the condition is called calcinosis cutis. It usually appears as small, firm, whitish or yellow bumps under the skin. They are often painless at first, which is why many people ignore them. Over time, the bumps can grow larger and harder. The skin over them may stretch or become irritated. In some cases, these deposits can break through the skin. When that happens, a thick white substance may come out. It often looks like toothpaste or a chalky paste. This material is made of calcium phosphate crystals that the body has been unable to remove. Seeing this can be alarming, but the process usually develops slowly and quietly before reaching this stage. Calcinosis cutis is more common in people with long-standing kidney disease, but it can also appear in certain autoimmune conditions. In kidney disease, the root cause is the loss of phosphate control. As kidney function declines, the body loses its ability to keep minerals in balance, and these deposits become more likely. While calcium deposits in the skin are uncomfortable and distressing, they are not the most dangerous outcome of high phosphate levels. In some ways, they are a visible warning that something much more serious may be happening internally. But if these crystals do not stop in the skin, what happens next can be far more dangerous. When blood vessels begin to behave like bone, the damage becomes much more serious. Healthy arteries are flexible. They contain smooth muscle cells that allow the vessel to tighten or relax, helping control blood pressure and blood flow. This flexibility is essential for normal circulation. When phosphate levels stay high for a long time, these smooth muscle cells undergo a harmful change. Instead of acting like muscle, they begin to behave like bone-forming cells. They start laying down calcium phosphate crystals directly into the walls of the arteries. Over time, the vessel wall becomes thick, stiff, and hardened. This process is called arterial calcification. It is not the same as regular aging. In kidney disease, it happens faster and more aggressively. On medical imaging such as an X-ray, arteries affected by calcification become clearly visible. Normally, arteries should not stand out on an X-ray at all. When they do, it means the vessel walls have become dense enough to block X-rays, similar to bone. In some cases, these hardened arteries can even be felt through the skin. Instead of feeling soft and elastic, the vessel feels firm and tight. Many doctors describe it as feeling like a guitar string under the skin. This loss of flexibility makes it harder for blood to flow properly and increases the risk of heart problems, high blood pressure, and poor circulation to vital organs. Arterial calcification also reduces the ability of blood vessels to respond to changes in the body's needs. Simple activities like standing, walking, or exercising place extra strain on the heart and circulation. Over time, this added stress can lead to serious complications. This mineral imbalance does not stop with blood vessels. The same chemical disruption that hardens arteries also interferes with how muscles work throughout the body. This chemical chaos affects the muscles as well. Nighttime muscle cramps are not always caused by low magnesium or overuse of muscles. In kidney disease, cramps often come from deeper chemical changes happening inside the body. One of the key players is a hormone called FGF23. This hormone increases when phosphate levels rise, which commonly happens as kidney function declines. FGF23 tries to protect the body by telling the kidneys to remove more phosphate in the urine and by reducing how much phosphate and calcium are absorbed from food. It also blocks the activation of vitamin D. Active vitamin D is essential because it helps the body absorb calcium from the gut. When vitamin D activation is reduced, calcium levels in the blood begin to fall. Low calcium makes nerves and muscles more sensitive. Muscles may contract more easily and relax less efficiently. This creates painful cramps, especially at night when the body is resting and small imbalances become more noticeable. Many people describe sudden tightening in the calves or feet that forces them to wake up and move around for relief. Magnesium also plays a role. In early kidney disease, magnesium levels can drop, adding to muscle irritation. At the same time, the blood may become more acidic due to reduced kidney function. Increased acidity further disrupts how muscles contract and relax. These combined changes explain why cramps can appear even without heavy exercise or dehydration. Night cramps are often dismissed as harmless or blamed on aging. But when they happen frequently, without a clear cause, they may be signaling that the kidneys are no longer keeping minerals in balance. Poor sleep from repeated cramps also adds stress to the body and worsens overall health. The body works hard to keep calcium levels stable because calcium is essential for survival. When minerals cannot be controlled through diet, hormones, and kidneys, the body looks for another source to maintain balance. And when the body can no longer manage minerals properly, the bones are the ones that pay the price. Losing height is not always just a normal part of aging. In people with kidney disease, it can be a sign that the body has started breaking down its own bones to survive. This happens through a condition called secondary hyperparathyroidism. When calcium levels in the blood drop, the body releases more parathyroid hormone. This hormone's job is to raise calcium levels quickly. Since the kidneys can no longer activate enough vitamin D or control phosphate properly, the easiest way for the body to get calcium is from the bones. Parathyroid hormone tells bone cells to release calcium into the bloodstream, even though this weakens the bones over time. At first, this process is silent. Bones slowly lose their density and strength. This condition is known as osteoporosis. Bones become thinner, more fragile, and more likely to break. Because the change happens gradually, many people do not realize their bones are weakening until a fracture occurs. One important warning sign is loss of height. Small fractures can develop in the spine without a major injury. These fractures compress the vertebrae, causing the spine to shorten. People may notice that they are a few centimeters shorter than they used to be, or that their posture has changed. Back pain may appear, but sometimes there is no pain at all. Other red flags include fractures that happen after a minor fall or simple movements. Breaking a wrist from standing height, a hip fracture after a small slip, or spinal fractures without trauma are all concerning signs. These injuries suggest that the bones are no longer strong enough to handle normal stress. This bone damage is not just a bone problem. It reflects long-term imbalance in minerals and hormones caused by kidney disease. Once bones are weakened, recovery becomes harder, mobility declines, and overall health suffers. The body pays a heavy price for trying to protect calcium levels. But mineral damage is only part of the story. After minerals lose balance, another threat begins to build quietly in the blood. After minerals, the attack of toxins begins. Nighttime itching that steals your sleep is more than just dry skin. In kidney disease, itching is often caused by a buildup of waste products in the blood, a condition known as uremia. When the kidneys cannot properly remove toxins, these substances stay in the body and start affecting different systems, including the skin and nerves. Uremic toxins can collect in the skin and irritate nerve endings directly. They also activate a specific itch receptor called PR2. Once this receptor is switched on, it sends strong itch signals to the brain. Unlike a mosquito bite or allergy, this itch is deep, widespread, and difficult to relieve. Scratching may damage the skin, but does not stop the sensation. Over time, the problem becomes even more complex. These toxins do not stay limited to the skin. They can affect the nervous system and activate itch circuits in the brain itself. When this happens, the brain becomes overly sensitive to itch signals. Even light contact with clothing or bed sheets can trigger intense itching, especially at night when distractions are gone. Many patients describe this itch as relentless. One patient explained that he scratched so much during the night that his skin started bleeding. He tried changing soaps, lotions, and detergents, thinking it was an allergy. Nothing helped. Blood tests later showed advanced kidney disease, and the itching was one of the earliest symptoms that pushed him to seek medical care. This kind of itching often gets worse at night, leading to poor sleep, exhaustion, and emotional stress. Lack of sleep then weakens the body further, creating another harmful cycle. Because itching seems harmless on the surface, it is often ignored for too long. But itching is only one sign of toxin buildup. When these toxins reach the brain, they begin to cause even stranger and more disruptive symptoms. Feeling an uncontrollable urge to move your legs at night is not just a sleep problem. This condition is known as restless leg syndrome, and it is common in people with kidney disease. Symptoms usually appear when you lie down or try to relax. The discomfort creates a strong need to move the legs, making it very hard to fall or stay asleep. One of the main reasons this happens is related to iron. The brain needs iron to produce dopamine, a chemical that helps control smooth and relaxed movement. In kidney disease, toxins in the blood trigger inflammation. This inflammation increases a hormone called hepcidin. Hepcidin blocks iron absorption from food and traps iron inside storage cells, making it unavailable for use. Even if iron levels look normal on standard tests, the brain may still be starved of usable iron. When dopamine production drops, the brain sends abnormal signals to the muscles, creating the restless sensation. This explains why moving the legs temporarily relieves the discomfort, but symptoms return as soon as movement stops. This problem shows how closely the kidneys and brain are connected. When the kidneys fail to clear toxins, those toxins interfere with hormones, iron regulation, and brain chemistry. The result is not just physical discomfort but serious disruption of sleep. Poor sleep creates another harmful cycle. Lack of rest increases stress hormones, worsens inflammation, and places more strain on the kidneys. Fatigue builds up during the day, but nighttime remains restless. Many people live with this pattern for years without realizing the kidneys may be involved. Restless leg syndrome is often treated as a separate issue, but in many cases, it is a signal of deeper imbalance. When kidney-related toxins are part of the cause, addressing sleep alone is not enough. Now consider this. If toxins can disrupt sleep and movement, imagine what happens when they start changing how food tastes and how hungry you feel.